want to explore this idea a lot more because there's so many themes, and I'm just going to list them out, and maybe we can explore them. One
Sure.
is exactly what's happening to these people's lives. The article in Medscape that Nina Teicholz wrote covering this was actually peered back the curtain into a person's life who was living in a shelter, somebody who had diabetes and was basically, was given access to the Mediterranean diet and it didn't work. And so this idea of, I feel like I hope you can expand on that for us, because I know, sometimes we talk about it, but people don't know what it feels like to be in a single room occupancy apartment or to be a shelter and
Hmm.
still need to reverse your PCOS or obesity or diabetes. But there's so many
Yeah.
other topics to like cover there. One is, we've done food pantry programs, they've never dented A1C. And here we have a low carb approach with your clinic and your company, and it's having an impact. And then, so the disparity of that data, like the data from Faith DM trial and other trials that have, were long-term aggressive whole grain and vegetable promoting programs that didn't help. And then the last one is this idea that we need to give processed food to the poor, and saying that we
Yes.
shouldn't give processed food is being disenfranchised and elitist. So I'd love for you to like tackle these three because I think that they're important to this discussion. Walk us through those lives. People want to know, how does the data that you're seeing compare to the Faith DM trial, which was a bust? And, is it elitist? Are we elitist here that we should, you know, impose a low carb diet on people who absolutely don't want it?
Okay, let me see if I remember the order of this, but
Yeah.
basically let's think about, even within this population, there's a gamut, right? There are people in shelters and there are people um, who do have a job and are working and are trying to make ends meet. And I think I think what strikes me is the amount of challenges that they have. Okay. So for example, today we were talking about a patient who lives with a hoarder. So he doesn't have the capability of having any food around because it's just gone. And so and he also doesn't have anywhere to cook it. So, in a very small space. So we're teaching him how to use a microwave for cooking healthy food, how you can boil an egg, and or it's just there are many. Well, we were also thinking in the shelter also, you don't have access, you can't cook your own food. So how do we do that? All of these are challenges that we have been dealing with. And how to, when you get the food stamps, how are you going to spend that money? Well, it turns out actually that junk food is really expensive. And since you're always hungry, it ends up being much more expensive than you think. Ironically, patients are saying that they're saving money. So, one of my patients says that when she tried, like to eat very healthy, she would always go and get fresh produce because this is what she thought she had to do. So she filled up her pantry with fresh produce, and half of it had to be thrown out because she didn't get to finish it. So she's now saving money by buying, frozen food and frozen vegetables, and like your frozen meat and frozen vegetables. And it's lasting her much, much longer. And she says, I'm actually saving money. Those were her words.